And Lisa, apologies, I think you're on mute.
Good morning, everyone. Welcome to the CalAIM Path TA Marketplace Vendor Webinar. Next slide. In today's webinar, we're going to recap the TA Marketplace to date, provide instructions for Round 5 vendor procurement, share TA vendor best practices, review key vendor policies and processes, and finally, we'll host a Q&A session at the end. By way of introductions, along with others from DHCS, we have Michael Weezar. He's the Chief of the Managed Care Program Oversight Branch. Shell Wong, Chief of the Project Coordination Section. And myself, Lisa Bistra. I am the Chief of the Providing Access and Transforming Health Unit. With our colleague from Public Consulting Group, we have Trish Perizzelli. She's the TA Marketplace Advisor. Jenna Wall, TA Marketplace Team Lead. Eliza Met, TA Marketplace Team Member, and Katie McGuire, TA Marketplace Team Member. I am going to go ahead and pass this on over to Jenna now.
Thanks, Lisa. So to kick us off, just going to do a very brief recap of where we are to date with the TA Marketplace. Just for everyone's awareness, we are recording today's webinar. We will be sharing the materials and posting them to the website once we have the recording and Q&A document available. And additionally, the first portion of today's webinar will be focused on overview of the marketplace and then round 5, procurement, followed by some TA vendor best practices that's really geared towards our current vendors. We can go to the next slide. So just to recap, for those of you who are new and interested in becoming a TA vendor, what is the marketplace? So the TA marketplace enables entities that are currently providing or intend to provide ECM, enhanced care management, and or community supports under CalAIM to receive free technical assistance from qualified vendors. Vendors are able to promote their services on the virtual marketplace where eligible entities can access those resources. The marketplace is managed by Public Consulting Group, which serves as the third-party administrator with oversight from DHCS. Next slide, please. The different modalities for accessing TA Marketplace resources include on-demand resources, which are publicly available resources through the TA Path website, off-the-shelf projects, which are standardized projects with well-defined program goals and deliverables set by the TA vendors, which are approved through the TA vendor procurement process, and then hands-on projects that are really unique projects tailored to the needs of a TA recipient. We can go to the next slide. The TA Marketplace is split into 7 different TA domains. For those of you who are looking to become approved as a TA vendor, you are approved for each of these 7 domains. So you would need to specifically apply for each one that you would like to serve as a TA Marketplace vendor. These domains span across several different areas of focus and range from building data capacity, supporting contracting with managed care plans, and workforce development. Next slide, please. Our eligible TA recipients include cities, counties, community-based organizations, correctional agencies, providers, and other entities that are, again, currently or planning to provide ECM and community supports. TA recipients must demonstrate that they are either already contracted with a managed care plan or engaged with a managed care plan to provide ECM and community supports. And we have shared the acceptable documentation should you be working with a potential TA recipient to be approved on the marketplace. Additionally, acknowledging that the TA Marketplace does support contracting, we do have another pathway by which organizations may be approved by DHCS, which includes the completion of a survey, which then is reviewed and approved by DHCS. Next slide, please. So to date, we just wanted to share where we are in the marketplace. We have had over 600 organizations apply as a recipient, and so far almost 550 have been approved. We do review these applications within 10 business days between Public Consulting Group and DHCS, and it spans across several counties in California. Next slide. Also, to date, we have 116 of you approved TA vendors with over 500 off-the-shelf projects across the 7 TA domains. Our next procurement is in January, which my colleague Eliza will discuss. But we are looking to add more vendors to the marketplace to be available for our recipients. Next slide, please. And for our marketplace projects to date, we are happy to share that we are close to 1,000, or close to 900, apologies. This should say that 992 projects have been submitted. Close to 844 have been approved, representing $83 million in executed funding. We are currently still aiming to review and approve within those 10 business days. If you have any questions and concerns around a specific project, please feel free to reach out to the TA Marketplace email address. Next slide, please. I will now pass it to my colleague Eliza to discuss the round 5 vendor procurement.
Thanks, Jenna. We can go to the next slide, please. All right, so the much anticipated TA vendor round 5 application period will be opening on January 1, 2025. All applications are due by the end of the month, so 5 p.m. Pacific time on January 31st. And please be sure to complete all components of the application before submitting. Otherwise, we will not be reviewing the application. So make sure you have those signed by an authorized representative as well. The round 5 vendor procurement is targeted procurement this time. So we're seeking vendors with specific experience in the following areas of focus: rural providers, tribes and Indian healthcare providers, justice-involved providers, maternal and child serving providers, and transitional rent providers. TA vendors that don't show experience with at least one of these areas of focus will not have their application reviewed. Next slide, please. All right, so there's a slightly different process for new applicants versus contracted TA vendors. For new applicants, you all may apply in one or more of the TA domains, the 7 domains that Jenna just went over a few moments ago. Applicants must show for each TA domain in which they apply that they have experience with serving one or more of those areas of focus I just reviewed. Based on the resources provided for each TA domain, applicants will be considered for being flagged as experienced with serving one or more of those areas of focus. You can apply using the application on the TA Marketplace website portal, and new applicants should create an account. You can follow the instructions that are linked here on the slides, and slides will be made available after the webinar today. There is also a comprehensive guidance document which walks you through the entire application process, all of the questions, the scoring rubric. That is also linked on these slides, which will be shared, and it's available on the TA Marketplace currently. For contracted TA, can you go back? Thank you. For contracted TA vendors, there are a couple options for you to consider. So you can apply to be flagged on the marketplace as experienced with serving an area of focus, or you can apply to be flagged on the marketplace as experienced with serving an area of focus and apply in new TA domains. And in those domains, you would specifically demonstrate your experience with serving an area of focus. Additionally, but separately, you can apply to submit on-demand resources that will be reviewed and selected by DHCS. So on January 1st, contracted vendors will receive jot form links, one for TA domains, one for on-demand resources, and that's the process you will follow for submitting applications for round 5. There is separate guidance for contracted vendors for the round 5 process, also linked on the TA Marketplace currently and linked here in the slides as well. Next slide, please. All right, new TA vendor applications. We're going to give you a bit of a deeper dive. Next slide, please. All right, so section 1 of the application is asking for vendor information. This is just your contact information, organization size, stuff like that. It also includes a section for your mission statement. We encourage applicants to keep the mission statement section brief. We've seen pretty robust responses previously, and while it's helpful context, that section is not scored. So we appreciate the context, but save the meat for the remainder of the application. Section 2 is capacity and payments. This section asks the applicant to describe the organization's approach and experience in providing TA, and then how they manage those TA projects. Section 3 is vendor experience. So here we're asking for information regarding your experience within the areas of focus and within Medi-Cal and other US states. And if you don't include information regarding your experience with one of the areas of focus, the application will be denied. So make sure you make that connection and show us how you worked with and supported an area of focus historically. Section 4 is domain experience. This section is asking for information regarding your experience within each TA domain applied for, including up to 3 TA projects showcasing this experiences, 2 references, and staff resumes. Again, if this section doesn't include information regarding your experience within the specific TA domain and serving an area of focus, the application will be denied for that TA domain. And section 5, this section requires the applicant to agree to the terms and conditions and have an authorized representative sign. Next slide, please. And this is the review rubric that we use with those points associated with each category. This is included in the guidance document that you all can access and use as you complete your applications. This is the criteria we look at when scoring, and it gives the relative weight of each category. Applications are rated out of 100 points, and we assign a passing score of 65. So if you reach that threshold, you have a passing application. Next slide, please. Just some takeaway tips to consider. Do limit your organization's mission to a high-level overview of your organization. Refrain from including example projects, as this section is not scored. Or if you do include them, make sure you include them later on in the application in a section that is scored. Within the capacity section, include information about the processes and platforms your organization uses to provide and manage TA projects, and provide detailed examples of how your organization has provided TA to one of the areas of focus within both the Medi-Cal, other state, and TA domain experience sections. And also make sure your TA examples are in alignment with the TA domain selected. Start early and definitely rely on the round 5 vendor procurement guidance for new vendors. It has all this information and more than you could ever want, probably, to complete the application process. Next slide, please. All right, now for contracted TA vendor applicants. Next slide, please. Section 1, vendor information, very similar to new applicants. We're just looking for your contact info, and then you are going to indicate what you're applying for in the application, because you do have a couple options. So Section 2A is applying to be flagged in the marketplace as experienced with areas of focus. This will appear for all contracted vendors and request information regarding your experience with the area of focus within Medi-Cal and other US states. And then 2B, if you also want to apply to add new TA domains, this is where you would select that and would request information regarding your experience within each TA domain applied for, and asking for up to 3 TA projects showcasing your experience, 2 references, and resumes of staff. Section 3 is attestation and certification, so having an authorized representative sign the application. Next slide, please. And here is the scoring rubric. So it's a bit different than new vendors, because we do have a part of your score from your initial application from the prior round in which you applied. So for the flag as experience with an area of focus, this is actually a pass-fail scoring process. We look at the project summaries you've provided and ensure that there's a clear connection with an area of focus. And if you pass this section, you'll be flagged as experience with that area of focus in the marketplace. For the new TA domain, we do pull your capacity score from your prior application, and then we review the information provided in the application for your experience in the new TA domain and your experience with an area of focus for a score of up to 40 points. And we combine that with your prior score, again, for a total passing score of 65 points out of 100. Next slide, please. All right, and then the on-demand resource application for contracted vendors. So again, applicant information, section 1. Section 2 is the resource information. So we're looking here for information about the fully developed resource, including its name, format, targeted users, and costs. The section also requests a summary of the resource, its current use, how it will support organizations to provide enhanced care management and or community supports. And then to be considered, the actual fully developed resource itself must be uploaded or sent to us via the inbox. And applications that don't provide a copy of the resource will not be considered. This section will repeat for up to 10 resources. You may submit more than 10, but to do so, please submit an additional application filling out all sections. And then section 3 is the attestation and certification section. Same as before, agree to the terms and conditions and have an authorized representative sign. Next slide, please. And here's the review criteria. It's again, pass, fail. We're looking at format, targeted users, cost, is it fully developed? Does it support the goals of CalAIM, PATH, and the on-demand resource library? Does it support organizations in ECM and community supports development? And how has the resource been used to date? And the resource summary will be evaluated first, and then we'll look at the actual resource that you have submitted separately and assess from there. Next slide, please. Just some tips and tricks for the application process. So for those who are looking to be flawed as experience with areas of focus and who are looking to provide TA in new domains, be sure to select a choice that matches your desired additional experience that you want added to the marketplace. We recommend completing the application in one session to avoid losing any work, and ensure your example TA projects showcase your experience serving one or more of the areas of focus. And if you do select this option, are in alignment with the TA domain selected as well. For on-demand, resources should be completely finished and developed with a final cost for DHCS to post on the resource library, which is accessible to the public. Resources must be uploaded or sent to the TA marketplace via email to be considered for selection. And if you would like to submit more than one resource, please submit it as part of a separate application. If you want to submit more than one, it's all fine in one application, but up to 10. And then if you want to submit more than 10, submit in a separate application. And also start early and use the guidance that is posted on the TA marketplace and is also linked in the slides. Next slide. Just some post-vendor application steps. So vendor profiles, very important. New applicants will be asked via email to complete their vendor profile, including information about their organization, labor rates, client testimonials, and more. Contracted vendors will be requested to provide labor rates for the TA domains that they applied for during round 5. You will not be able to make updates to your vendor profiles or already approved labor rates. Application decisions. All applicants, including new and contracted TA vendors, will be informed of DHCS's decision via email, which is anticipated to be in the spring of 2025. Next slide, please. I think I'm handing it off to Katie at this point.
You are. Hi, everyone. So we're going to go over some of the best practices for vendors. If you go to the next slide. So the kind of the steps and roles about the TA marketplace, the recipient who needs to submit the eligibility application and receive approval before they can access projects in the marketplace. You do not have any formal role in this process, but in practice, you may help them navigate the application process. Once they're approved, they're able to submit project eligibility applications or PEAs. The TA recipient is the one who completes this application and completes the submission of it. We do encourage recipients to reach out to vendors and get a consultation prior to submitting the PEA, especially if they're requesting a hands-on project. So you as the vendor, you do not have a formal role, but you may help the recipient formulate and draft the PEA, looking at the approach of projects, especially when it comes to hands-on. And then once that application has been reviewed and approved, then you will be able to begin the SOW and budget, the scope of work and budget. You are the one that is completing it, but expected to work in collaboration with the recipient to develop the SOW, especially talking about timelines and looking at their other projects within the marketplace when discussing that. Once you do develop it, the TA recipient must review and approve it, and then you as the vendor will submit the SOW for our review. If you go to the next slide. So a little bit about the project types. There are two different project types that you can select, a deliverable-based and a time and material-based project. Deliverable-based, they require a lot of detail information within the description to be completed. So what's being completed, the outputs being provided, and the timeline and staffing for the work. Most often off-the-shelf projects are deliverable based, but they are permitted for hands-on projects. A big note is that invoicing cannot occur until the entire deliverable is complete. So deliverables are not broken out into tasks or as partial deliverables. They cannot be invoiced. We recommend splitting out larger deliverables into multiple deliverables, making them smaller. And also, when invoicing, you cannot exceed the deliverable cost. For time and materials is a little different. They still require detailed information about the work being completed, outputs, timeline, and staff. These are most often used for hands-on projects because those hands-on projects are tailored to the recipient support needs. But that is permitted for the off-the-shelf projects. With this, you can invoice on a monthly or quarterly basis, and you may use the tasks to break up the deliverables or use additional deliverables. Invoicing can exceed the deliverable cost in this. However, it cannot exceed the total project cost. So if you have a little bit more time and go over by a little bit in one deliverable, you are going to have to account for that later on to ensure that all work can be completed within that project cost. If you go to the next slide. So some of the challenges that we see, so with the SOW and budget, some of them that we see is that the goals do not match the project eligibility application and or the off-the-shelf project description. So you should be working with the TA recipients, ideally before the PEA submission, to identify the goals of the project. If the OTS project, the goals and deliverables, they must match the vendor's approved off-the-shelf project description. The SOW project goals do not match, it will be sent back for rework. Another challenge is that the deliverables don't align with the goals and the objectives outline don't align with it, and they may be unclear. So you need to make sure that before submitting the SOW and working with collaboration, developing it with the recipient, that the deliverables are clearly outlined, aligning with the project goals, as well as the deliverable description should be clear and address each goal in the SOW. And if they do not align or the goals are missing, it will be sent back for rework. Another one is that the SOW is submitted and the project includes multiple phases. So TA projects cannot include multiple phased aspects of it. Instead, they should be separated out into separate projects for each phase. Submitting multiple project is allowed. The first phase would be one project, and that would better inform the subsequent phases for the new SOWs that will be submitted at a later time. If it includes multiple phases in the one project, it will be sent back for rework with instructions to submit subsequent phases in future projects once the work has been identified. If you go to the next slide. Some more challenges that we experience are the deliverables are not concrete, or the work and outputs are not clearly what's going to be delivered. So all SOWs and budgets, including time and materials, should have deliverables with clear work to be completed. The deliverable description should be as detailed as possible to support our review and the TA recipient's understanding of the work that will be conducted. If it's not concrete, such as a deliverable being ongoing support, then it will be sent back for rework. Again, the non-duplication of funding section is very important. And if it is not completed, it will be sent back for rework, or if it's not clear, it should be completed for the recipients if they've received any other projects, if a batch of projects are being submitted, even though they have not started, if they've received cited funding, JI grants. This does need to be completed looking at how the projects are different, how they're complementary or supplementary, any connection, and ensuring that the areas are different and they do not overlap and are non-duplicative. If this is not clear or not provided, then it will be sent back for rework. And just so it's known, this also includes TA projects that have been either completed or are active in process with other vendors. This should be a part of the conversation that you have with the recipient when developing the SOW. Another challenge is the other direct cost, specifically travel information. So with the SOW, if you're requesting travel for in-person TA efforts, it must include the rationale for the travel being included, information on the in-person efforts, what deliverables being completed with it. We do recommend that this information is clearly stated in the communications section of the SOW and or the deliverable associated with the in-person work. The travel submitted, they must follow the labor rate and travel guidance, including splitting of the direct cost by travel type. And they need to be clearly broken out, as well as please ensure that the information provided, the math is done correctly and calculates for each of those areas. Otherwise, it will be sent back for rework. You can find the labor rate and travel guidance in the vendor policy guidance, and it will also provide links to the GSA rates to follow. If you go to the next slide. So amendment challenges. You already have an SOW that's approved, you've been working on it, and there needs to be some changes. So submitting the amendment, there's a no cost extension or a full amendment. Some challenges that we're seeing is that once a no cost extension, for example, has been submitted and approved, that when the SOW is resubmitted to us, the end dates do not match what was requested. If they do not match the request, they will be sent back for rework. Noting that if submitting an amendment request to add new roles or change rates or to add additional rates, to approved SOWs, they cannot be amended to add these new roles or rates. Amendment request submitted that is requesting this area will be rejected and not receive approval. If you are submitting a no-cost extension, please be aware that you should have the conversation with the recipient to ensure that the legal signatory in that prior version of the SOW is still the same. With a no-cost extension, you are only able to change the end date of the project. It will not open up any other areas for changes. So if it is identified that the recipient does need, or you as a vendor need to change and update that legal recipient or legal signatory, then there is a different process and you will need to submit the full amendment request allowing for that change to be completed. If you go to the next slide. So now you've had the approved SOWs, whether it's the version 1 or amendments, and you're ready to invoice. So some challenges that have been seen are that multiple invoices being or attempted to be submitted per month, invoicing for the current month. TA vendors can only submit one invoice per month for each SOW and can only submit once the month has ended. The console will not permit multiple invoices for an SOW in the same month, nor will it allow invoicing for the current month. Invoices submitted not yet approved. So please be aware that the invoices must be approved by the TA recipient before the finance team can complete their reviews. Recipients must approve by the 15th of the month to be able to be reviewed and included in the next pass-through request for the following month. And this is assuming that there's no rework needed and it is approved by finance. Deliverables on the invoice do not match the SOW. A TA vendor will now see a drop down of the deliverables in that SOW when they're invoicing to avoid reworks. This is a new change and you will see it as you're submitting new invoices. Invoices submitted for work conducted after the project end date. Please note that that project end date, that final deliverable, is the end date of the project. So any work completed after that cannot be invoiced. If you're coming up to the end of the project and need more time, you need to be submitting an amendment request for the no-cost extension prior to that end date. Invoices are due within 60 calendar days of that project end date. And then if you have any questions, please make sure to review the amendment policy and process if changes are required. If you go to the next slide. All right, and I think I am passing that back to Jenna.
Yes, that's correct. Thank you so much, Katie. We can go to the next slide. The purpose of this section is to provide some key policies, specifically updates that were shared via the TA vendor policy guide December update, shared with all of our current TA vendors at the start of the month. This is available on the TA Marketplace website under resources. So the first is some TA project guidance. We can go to the next slide. So TA project timelines. So we have seen a few questions in the chat about different items regarding timelines. At this time, DHCS is still determining the final date that projects will be accepted on the TA Marketplace. Guidance about final project dates will be forthcoming. It is important to note that the waiver period does end in December of 2026. For project length, currently there is no policy regarding a TA project's length. However, if a project is submitted for over a year, that will go under an additional review and may require some justification for that extended period of time. Additionally, we do request that projects be submitted for at least 4 weeks in length, even for a single-day training session. This will allow sufficient time for our team to review and approve the project, as well as gather necessary signatures for execution, and will support should there be any delays with actually executing the training itself. And then for project start dates, projects will not be able to be submitted to PCG, the TPA, if the project start date is less than a week from submission. So if you do try to submit a project to us that starts tomorrow, the console will not allow you to do so. We do actually suggest that project start dates be 2 weeks after the submission date to allow the 10 business days necessary to review and approve. Next slide, please. Project development. So we've seen a few different projects focus on these 2 key areas that we wanted to share with you all. The first is grant writing support. TA vendors that are engaging with recipients on supporting with identifying, developing, and managing grant funding that may include cited, IPP grants, or other funding must complete the sustainability section of the scope of work and budget that indicates how the project will support the TA recipient to independently write and manage future grant projects. The TA marketplace will not approve projects that are having a TA vendor just support or write a TA grant application, as that is not the intent of the marketplace. The intent is to provide technical assistance that will allow a TA recipient to do these projects in the future independently. Projects that do not complete this section will be sent for rework. For IT infrastructure projects, we want to ensure that projects with IT components are compatible with MCP policies. So this is a new policy that we are enacting that requests that all TA projects that have a component tied to IT infrastructure should contain a goal or a deliverable that includes communication and or collaboration with the local managed care plan on how this will support interoperability and compatibility between systems. If this is not included as part of the project, again, this project will be sent for rework. Next slide, please. Scope of work and budget amendments. We can go to the next slide. So just a quick overview, DHCS and the marketplace do recognize that there may be some unpredictable factors that result in the delays of projects or small changes to the initial scope. Therefore, we do have a process by which TA vendors may request an amendment. These amendments are submitted to the TA marketplace via email and must have the submission of the updated amendment request form that is available in the TA vendor policy guide and was sent to all TA vendors as part of that updated December policy guide. Please note that amendments must be submitted at least 10 business days prior to the project end date, and retroactive amendments will not be accepted. We will not accept projects or amendments to projects that were completed in November and December. Amendments are not guaranteed to receive approval and will be reviewed on a case-by-case basis. Important to note is that as you are going through the amendment process, vendors will not be able to invoice during that process by which you are updating the scope of work and budget. You will be able to invoice once the scope of work and budget is complete and signed by all parties. Next slide, please. So we have 2 different amendment types. The first is our no-cost extension amendment. An important update is that as of January 1st, we will only be allowing 1 no-cost extension per project, and that may not exceed 6 months. The marketplace really encourages vendors and the TA recipients to work together to identify timelines, current workload, staff availability at the start of the building of a scope of work and budget. That includes considering paid time off, holidays, etc. The no-cost extension request form must be submitted to the marketplace, and the console must match the new date that was submitted on that form. To date, we have seen several requests that indicate a different date on the form than what is submitted on the console, requiring us to go back to the TA vendor. No-cost extensions will only allow changes to that project end date in the scope of work and budget. So if your project requires a change, such as a legal signatory change, that will require the second type of amendment, which is a full amendment. For full amendments, as of January 1st, the marketplace will no longer accept amendments to add or remove roles to deliverables, changing labor rates, which it hasn't to date, and adding of new deliverables. Full amendments must have a clear rationale included in the request form for the desired change, as well as a red line version of the approved scope of work and budget indicating such changes. Acceptable amendments may include changes to legal signatories, adding a new service market to a deliverable. So for example, if you wanted to do an assessment of LA County and then wanted to add an additional county to that, that is something we would consider. Or to add or change a managed care plan exploration for contracting. Please note, again, that these amendments are approved on a case-by-case basis, and we require all of this additional information in order to consider your request. We can go to the next slide. This will be available to you all, so no need to fret, but this is the standard kind of process for scope of work and budget amendments. That form is sent by TA vendors and other documentation to the TA marketplace, and we categorize that into one of 3 requests. We will review that request with DHCS if it is a full amendment, and if more information is required, we will work with the TA vendor to obtain that information. Once it is approved, we will inform the TA vendor that you may be able to update that scope of work and budget. Once that is submitted to us, our team will review and ensure that that update matches what was requested in the form. And then we will have the amended scope of work and budget signed and approved by all parties. Next slide, please. The next process we want to talk through is withdrawing scope of work and budgets. Next slide. So while it's not desired, we recognize that there may be projects that do not work out between a TA vendor or recipient, or when beginning the project that needs may have changed. As such, we have created a process to withdraw a TA marketplace project. This requires the TA vendor and recipient to work together to complete and submit the TA project withdrawal request form that is available on the TA vendor policy guide. Next slide, please. Again, we kind of have a flow here for how this will work. Similar to the TA amendment form, we have the form submitted to the TA marketplace with both vendor and recipient included in that email. Our team will review and categorize it into one of 2 categories. One is that no invoices have been submitted or are awaiting payment. If that is the case, we will review the materials with DHCS as needed. And if more information is needed, we will request that from the TA vendor or recipient. If it was approved, we will inform the vendor and recipient, and we'll have the project withdrawn within the console. And please note, all vendors and recipients are still required to complete the progress report for withdrawn projects. If there are invoices that are waiting to be submitted or awaiting payment, we ask that the TA vendor inform the TA marketplace once all of those invoices have been paid, which is when we will then have the TA marketplace project withdrawn in the console. And again, all withdrawn projects must have a progress report completed for that time period indicating why the project was closed. Next slide, please. And lastly, we have the TA progress reporting update, which I hope is some good news to our TA vendors and recipients. Next slide. So just a recap of what the TA progress report's purpose is really to ensure that all projects are on track and achieving the stated goals, identify risks, and identify impact of the projects that can inform ways to improve the TA marketplace. Next slide, please. Starting in 2025, progress reports will be submitted semi-annually instead of quarterly. Progress reports will continue to be required for all active and completed projects during the requested time period. Please note that payment of invoices is contingent on receipt of semi-annually progress reports. Most TA project report questions have a yes or no drop-down and include some short answer responses about barriers and achievements to date. Next slide, please. So as stated, again, progress reports will be semi-annual starting in 2025 and will have fall and spring. So for projects completed, projects that are completed or have progress through April 1st and September 30th. That is our fall progress report as it is due on October 31st. And then we will have a spring progress reporting period for work that was completed between October 1st and March 31st, due on April 30th. So the spring progress reporting period will be the next progress reporting period that we are looking towards. And that again will be for work completed through October 1st and March 31st. Again, payment of invoices is contingent on the timely receipt of these progress reports. Next slide. All right, so we just wanted to walk through a couple of resources before we open it up to our Q&A period. Next slide, please. You may have already seen, but wanted to announce officially that our first on-demand resources that were developed by our TA vendors are available on the marketplace, on the CA Path on-demand resource library. This again is publicly available to anyone and can be accessed via that CA Path website link listed above. We are very excited to have these resources available, the first of which is CalAIM Navigator and Medi-Cal Managed Care 101. We anticipate more to be available in January and February, so please look for those updates regarding on-demand resources. Next slide, please. Additionally, we encourage you to share success stories. We do have this success story webpage for all of our CA Path work streams and encourage you and TA recipients to submit your story for publication on our website. We have the form linked in these slides available for you, and we'll be sure to circulate that to all of the attendees should you be interested in sharing a successful TA Marketplace project that has really supported our TA recipients. Next slide, please. And lastly, just want to share all of the available resources on our TA Marketplace webpage, including the Round 5 TA Vendor Application Guidance for new and contracted vendors, as well as that updated TA Vendor Policy Guide that was explored in some detail on today's webinar. We also included some TA recipient webinar and other application support should you be working with TA recipients to gain access or submit a successful project eligibility application. Again, we do have our TA Marketplace email address listed here. We typically give responses within 48 hours to any questions or concerns, and really do want to work together collaboratively to have a successful TA Marketplace project with our TA recipients. And with that, I think we can go to the next slide, which is just for questions. So I know that the Q&A availability is open, and we have had quite a few questions that we have been responding to throughout the time we have been on this webinar. I can take a quick look to see about some of the question themes that we have been seeing to date, but please continue to ask any questions that you may have regarding the TA Marketplace, specifically regarding Round 5 and any of the TA vendor policies that were covered during today's webinar. So I know a few questions came in again about the scope of work and budgets regarding how many you can have at what time, what is the length, cost associated. And again, TA vendors can have multiple scope of work and budgets with recipients. Recipients can have multiple projects. We just want to ensure that there's no duplication of funding. So please be sure that when you are developing that scope of work and budget, that you work with that TA recipient to identify any active projects or cited funding or JI funding that they may have to date to ensure there's no duplication of work. And additionally, please also consider your capacity as well as the capacity of the TA recipient to engage in another project. Right. A few questions came in about references for TA vendor procurement or for the TA vendor procurement. So yes, you can use the same TA reference. However, they should be able to speak to a specific work done in the domain for which you are applying. And again, each of your domain applications should also include examples of TA that you have provided to date that is specific to that TA domain within one of those areas of focus that Eliza highlighted and is available in our guidance. Additionally, for our contracted vendors, there were a few questions about being flagged as a TA vendor with experience with one of the areas of focus. If you are already designated as a rural provider on your TA vendor profile, you do not need to reapply. However, if you would like to have that flag as a rural provider or with experience as a rural provider, or you would like to be flagged as a TA vendor who has served one of the other areas of focus for the round 5 procurement, you must complete a TA vendor procurement application. Again, there are 2 options for contracted vendors, one that is only specific to the areas of focus and one that includes the areas of focus and TA domains. All right. TA experience reference, is that required? Yes, that is required. We do require the name, email, and a few other notes about folks that you have worked with that can speak to your experience providing technical assistance. There is a question about a full amendment to an OTS project due to adding a second managed care plan in more counties. That is something that I think we could consider. OTS projects are typically a little bit more rigid in that they have those defined project deliverables and goals. However, if it is not a change to a goal or deliverable, I think that is something that we could explore. So do encourage you to send that question to the TA Marketplace and we can provide you an answer to that. We have a question about examples of what a hands-on project might include. So hands-on projects, again, are those projects that a TA vendor is providing really unique provided TA to a TA recipient based on their needs. So it must fall in one of our 7 TA domains, but can span anything that a TA recipient might be interested in. So for example, we have had projects that are focused on supporting with contracting. Again, the OTS and hands-on projects can be similar. The hands-on project just has to be is more tailored to a TA recipient's need. So if an off-the-shelf project does not include something that a TA recipient is looking for, we ask that you submit a hands-on project. We have a question about a way for TA vendors to search TAM to help recipients find other vendors. Unfortunately, that is not a feature of searching. However, we do have filters available on the TA Marketplace. So if you have a TA recipient that is looking for a specific need, for example, support with billing, you may be able to use that filter to identify vendors who have experience or off-the-shelf projects to support that TA recipient. All right. Looking to see, I know some folks have dropped questions in the chat. And please continue to answer any questions, or if anyone on my team is seeing any questions I have not answered, please let me know. I do know that there was a question about submitting travel costs for scope of work and budgets. We do allow travel costs to be included so long as those costs are not part of a TA vendor's labor rates. That would be completed via the other direct cost section of scope of work and budgets. The GSA website does include rates for per diem meals, as well as mileage and hotel costs based on the location that a TA vendor would be traveling to and the time frame. So whether it be 2024 or 2025, that should be available in the TA vendor policy guide and will also be provided as part of the Q&A document. You mentioned areas of focus. Can you clarify what that is meant at that time? Yes. So the TA round 5 TA vendor procurement is a targeted procurement this time. We are only focused on identifying vendors that have experience providing technical assistance to one of the areas of focus that was identified in today's webinar, as well as the guidance available on the TA Marketplace website. Any vendor that is submitting, or potential vendors submitting, an application for round 5 that does not identify experience with one of those areas of focus will not be considered for the round 5 procurement. And a question about work examples within a domain are provided, but not specifically the areas of focus. It is just showing examples of you providing support to a rural provider or a tribe or Indian healthcare provider. So having that experience of a project with one of those provider types, so that we may be able to see that you have experience working with these different areas of focus. There are a few questions about model PEAs being available. So just for everyone's awareness, model project eligibility applications are available on our website and are a great resource for TA recipients if they have questions about submitting that. To date, we do not have that for scope of work and budgets or invoicing. However, the TA vendor policy guide really is a great source of truth for what we look for in terms of those specific TA projects, and this presentation about what we are seeing as concerns with rework from our TA vendors. This is something that we can consider, and we'll get back to you. We have had a couple of questions about labor rates and around round 5. So labor rates for contracted vendors are already established for the current approved TA domains. That period was open in October, and we anticipate that to open again in April. However, as part of the TA vendor procurement, new vendors will be asked to provide labor rates. As we are reviewing your TA vendor application, again, this will be part of that vendor profile that Eliza described and will not be a notification of your approval. We're just trying to collect all of that information should you be approved. Additionally, for our contracted TA vendors, if you are applying for a new TA domain, we will ask for the labor rates for that new TA domain. However, you will not be able to adjust your labor rates for your current approved TA domain, current TA domains. That will be part of that spring TA vendor profile update. All right. Looking to see any other questions. And again, any questions that we do not get to on today's webinar, we will also be including as part of our TA vendor webinar Q&A documents that will be sent to all registrants and will be publicly available on the TA Marketplace webpage. So encourage you to look for that email and availability on the website. We do have a question about including some information about the type of organization you are, such as a disabled veteran company. We do have some flags for different provider types that will be included as part of the vendor application. Would encourage you to look at the TA vendor guidance for new applicants. Right. Looking again to see any new questions. If not, I highly encourage everyone to look at the TA round 5 procurement guidance for new and contracted vendors based on where you fall into one of those two categories. Also strongly encourage you to look at the TA vendor policy guide updates that include some and more than just what was presented today. We really appreciate you taking the time to join us on today's webinar. Again, our materials will be shared with all registrants and be publicly available, and we appreciate your interest and collaboration on the TA Marketplace. We hope that you have a great rest of the day as well as a happy new year. Thank you, everyone, and I hope you have a good one.